Hey everyone, I hope your day is going well. I'm Dr. Monique Adu, a pediatrician, keeper of my home, homeschool mom, just wanting to share information that I feel to be a benefit to you all, whether it be about whole food plant-based nutrition, medicine, homeschooling, gardening, life, and just so much more. In today's video, we are talking about preconceived patient and provider perceptions that really can impact the way we receive care and the way we provide care. And this can mean a matter of life and safety risks. Join me today. Many of us have been to our doctor's office as a patient, and we expect certain things to happen. We may expect the provider to give us a certain request, to provide them speedily, and to really fulfill what our expectations were. As a doctor providing care, we may expect that the patient understands certain things. We may expect that they will play out or follow through with certain advice that is being given. However, it is so important for us to reflect upon how our preconceived thoughts and perceptions are affecting the care we receive, and how our preconceived thoughts and perceptions are affecting the care we are giving. It can honestly mean having safe and effective treatment and advice, or unsafe practices and unhealthy outcomes. Let's take a look at some examples. So if you'll take a look at this first side of the screen, you'll see that I have labeled it patient, and on the other side, I have labeled it as provider. As a patient, we may expect to receive a relatively quick treatment cure without having to make any personal and impactful lifestyle changes. I mentioned this before in several of my other videos, the importance of really focusing on food as medicine and moving away from the standard expectations of receiving medications, as medications do not solve our core problem that may be causing our ailments. The real solution is to dig deep into finding out what the cause may be. And to tell you the truth, oftentimes it has to do with our lifestyle, what we're eating, our nutrition, and how it then plays a role like a domino effect on whether we will be healthy or sick. So medications should be the last resort. They have their role, but they also can make things worse for us with the side effects that they can give, and just first and foremost, not touching upon the cause of the issue. So as a patient, it is important to really understand that a cure may not come quickly, whether you're given a medication or not, and a treatment plan may need to be done in gradual steps that you are to be the pilot for. You should be driving that plane or ship towards better health with the guidance of a doctor or qualified healthcare provider. We should not expect, therefore, to receive a quick cure. I know it would be so wonderful sometimes to receive a quick cure, but that doesn't get down to the core problem, which is figuring out what has caused our issue in the first place and solving that. So it's so important. We don't want to load our system with medications that may even be harmful. So as a patient, it is so important to not expect certain things that provide quick cures without making our own personal lifestyle changes, whether it be making sure that we're feeding our body with healthy foods that promote health and wellness and prevent us from accumulating and gaining all of these negative health issues in our life for ourselves and our children. Second example for the patient is that we may often get upset if we're not receiving what we thought was necessary. And many times, of course, we would feel or think that it is in the form of a medication. For example, oftentimes we come to a doctor for common cold symptoms, but these symptoms can be relieved without touching medications. We need to turn to our nutrition and our foods to help us to feel better and give our bodies time to heal. And first and foremost, prevent these things by ensuring our bodies are optimally provided the nutrition that they need. To make sure that our bodies are optimally provided the nutrition that they need to boost our immune systems and to keep us strong, so that if we do come across any illnesses that want to make its way into our system, that we are able to effectively fight them off. Oftentimes, medications do not clear these common viruses. It may just take down some of the symptoms we're feeling, but as I mentioned in another video, medications do not often help us feel better in the long run. And it is so important to remember or understand that our immune system puts forth some of those symptoms that we are feeling, such as having a fever, such as having body aches, such as just feeling out of it, fatigued. It is signaling us that we need to do something. And the fever is set forth as a part of our immune system to help to fend off those invaders. So we oftentimes, for example, may want to treat with fever-reducing medications, but this is going against our innate immune system's ability to fend off infection. Of course, if you have a question about whether the fever you're having is something to be concerned about, or if the fever that your child is having is something to be concerned about, please talk it over with your physician. But I am just bringing out the point that many times we are doing things that are counterproductive to our speedy recovery. We're actually slowing ourselves down and prolonging our healing. This also goes for giving antibiotics when we have viral symptoms. There are some cases where one may have a secondary infection or an infection over the virus because things have now really gotten to a point where it has progressed. And in those cases, antibiotics would be necessary to counteract a superimposed bacterial infection, but not for a primary viral illness with common viral symptoms like runny nose, nasal congestion, mucus. All these things are there to help our bodies clear that illness. And what we have to do is support ourselves while we're getting through these ups and downs, aches, and fatigue symptoms with the proper things that help us to do it safely. Let's go over to the provider side of preconceived perceptions that I often see myself. We may expect our patients to follow our advice that we give without question or reasoning. This is not good. As a doctor or provider, we need to be ready and willing to answer questions. And as I mentioned in my previous video, if we are not able to answer our patients' questions, take time to do it, we need to make a change. We are so inundated with all these things coming at us while providing patient care. So honestly, it is difficult to often take time to answer questions, but it's very, very important because we don't want to assume that a patient understands the instruction we have given or the prescription that has been sent, if it is being sent, if you have a reason to do it. We don't want to assume that the patient and family understood when really they didn't, because we didn't take time. We may also feel pressure to provide requested medications or just something in hand due to our time constraints and pressures. We know it, but we still have to be diligent and do what we can, because it can mean a matter of prolonging health or delaying one's recovery. Next, going back to some more patient perceptions. We may expect our healthcare providers to know all of our medical and health background, and we may feel upset when we're asked to tell it again. Please understand that your provider has a certain time allotted, and they may not even have all of the information there. Even though you may see that computer before them, it does not contain everything under the sun. It is only a snapshot, if any, of current medical issues, hopefully, and some past medical history as well, and medications that may be of pertinence to you, but it is not always updated as things should be. This is what we should strive to do. This is what many places strive to do, to keep all medical records and information updated. But if you, for example, go and add some more medications to your daily routine, or you just happen to have an incident that has added another health concern to your list, your provider may not have received that information yet, or ever will, based on where you went and whether medical information is transmitted. Not all records are transmitted over to your primary care provider. So please be patient and willing to provide updates. And if your provider is not asking or not aware, make them to be aware, because it can affect the things that you will receive or not receive. Many patients may feel that the doctor or provider knows best, and they may not question anything. This can also be a cultural thing. There are certain cultures that feel that they are not to question certain leaders. And this is understandable. We understand. But the provider is a human being like all of us, and none of us are perfect. So if we feel that there's something being given to us or being instructed for us to do, if we feel, I don't really understand why I'm doing this, I don't quite get what I'm supposed to do, make sure you understand before you leave. The doctor does not always honestly know best, but they try what best they can to make sure that they are making a good and sound judgment for the particular situation presented before them. Next up, as provider, we may think that the patient hand in hand understands the instructions that we're giving, and we may not take the time to ensure things are understood before leaving. So we need to make sure we're doing this, because we can even prevent much hassle and challenge later on down the line, having to go and backtrack and figure out things that should have been done before. And last, we may unconsciously treat certain groups or genders differently based on previous experiences and biases that we have. We all unfortunately have biases. The biases are formed based on our experiences. It is just natural to have certain thoughts come our way if we are confronted or presented with a similar person, situation, challenge, or issue. We dig back into what we have already experienced, and we use that data to help us to confront or solve, or I should say, to deal with or make a decision with what we have in front of us. This, however, can be detrimental and not helpful for the patient before us. We don't want to assume that because this person is a mother or a female, that they have certain understanding of things. Or we don't want to assume that because this certain group or culture does this, as I have seen before, that they must be doing this all the time, that they would make sure that this is done. Or when someone comes in expecting to receive care from us, let's not take the situation that we have had before with another individual person and place that same emotion and thought on a totally different person. Research has shown this to be detrimental. Research studies have even seen where certain groups of people, for example, colored patients, may come in for a similar issue, and when the care is compared to someone else of a non-colored persuasion, the treatment is very different, whether the person has high financial status or not. And this can lead to medical errors, lack of care, unnecessary issues, and just honestly, frustration on the patient's end. We are not to assume something of someone else based on someone totally different. This is not how we would want to be treated, and it's definitely not the way that we should treat patients and others as those that are respected and held at a high standard to give the highest quality of care. So as providers, let's do what we can. Come with your mind ready to listen to this individual patient, this individual family. Try your best to bracket preconceived notions and emotions that may come up when you see a certain type of person, a certain group of people. It can just be a wide array of things. Try and bracket what you have previously experienced. We are not saying to forget it, but we are saying treat everyone individually. Take your time and make sure you're providing quality care that you would want for yourself and family. And as patients, take time to understand the provider is not perfect. However, they should be your guide and teacher and lead you into healing and finding the root cause of a problem versus just a Band-Aid. I hope this was helpful for you. If you have any questions or comments, please go ahead and leave them below. And until next time, be blessed and do the best you can to remain sustainable.